Welcome to Startup Health Now, the weekly webcast that celebrates the healthcare transformers and change makers reimagining healthcare. My name is Unity Stoakes, and today we're here at the Wearable Tech and Digital Health Summit in New York City. Got a very special guest, Dr. Robin Berzin, an amazing physician who's really reinventing how health and wellness gets delivered. She's a practicing physician, and we're going to be talking all about her new business, Parsley Health. Stick around.
It is the duty of leaders to lead, of the creative to create, of the daring to do. The free world expects leadership of us. Its fate and our fate depends upon our leadership. We are industrious, inventive, restless, with the fires that burn within us. Well, I say that nothing is easy, and the best things are the hardest. And all our troubles, all our immense difficulties, now and in the future, can I say, be solved if we have the will, the courage. The future is to those who take it.
Welcome back to Startup Health Now. We're here with Dr. Robin Berzin.
Hello.
Great to be here.
Thanks so much for having me.
So just to kick things off, I'd love to learn more about you.
Okay.
How did you first get involved in health, wellness, healthcare?
Yeah, so I was not pre-med. I was working, my first job was actually downtown here at the U.S. Attorney's Office prosecuting securities fraud and Martha Stewart and such.
Wow.
And I hated that, and I was like really glad that somebody prosecuted securities fraud, but I thought that it probably shouldn't be me. It was too punitive, and I started going to yoga all the time. And there was this tiny studio that had just started, it was right after 9/11, so the financial district, this area we're in, just really was coming back to life. This tiny yoga studio was there, and I would always kind of escape my paralegal job and go to yoga, which is terrible. But I just had this massive aha moment personally that most people are living with a big concrete wall between their heads and their bodies. There's not a lot of crosstalk here, and that is really generating a lot of the behaviors that are really causing all of our chronic health problems that are so, dominant today. And it was really just this seed that got planted in yoga that sent me off in this totally different direction to working at NYU in mental health in their psych department and a research job to see if I even wanted to go to medical school, then having to go back and do post-bac, which I went back to my undergrad in Philadelphia to do. And then I ended up, just as before he had a TV show, Dr. Oz had a radio show on Oprah's radio station. I ended up being the associate producer for that. And in that job, I met all of these doctors who were doing things differently and were practicing integrative and functional medicine and just kind of thinking outside the box. And, again, for me, yoga and this connection between the mind and the body was really why
And you're a yoga instructor as well?
I mean, they said that today when they announced me, and I was like, oh, geez, haven't taught yoga. Where'd she get that bio?
Right.
Haven't taught yoga in years, but at one point, sure.
So you're a physician.
Yeah.
You were a yoga instructor
Yeah.
at one point, at least inspired by
Forever
yoga.
in spirit.
Right. You're also an entrepreneur or doctorpreneur.
Yeah. I love this title, doctorpreneur.
Yeah. So you've just launched, it's been a while now, Parsley Health.
Mm-hmm.
What is Parsley Health,
Okay.
and what's the mission behind it?
Yeah. So Parsley is the first modern, affordable functional medicine practice and wellness center. So I'm a doctor. I'm an MD. I went to regular medical school and trained in internal medicine, but I practice something called functional medicine, which is a growing field. The Cleveland Clinic, the #1 hospital in the U.S., just opened a $50 million functional medicine center, research center, and clinical center. And functional medicine is an approach where we focus on getting to the root cause of disease rather than just band-aiding it with drugs. And we use natural options wherever we can. That can mean nutrition and diet, movement, mindfulness, stress reduction, nutrients, and really in-depth testing to look at how your body is functioning right now rather than waiting until you get some disease and then trying to triage that, which is what conventional medicine does today. So it's this. We use all of the same evidence-based data, peer-reviewed data that conventional medicine doctors do, but we look at the body in a very different way. And it's this interconnected matrix, not a series of isolated organ systems. And we help people achieve optimal health. So I always say conventional medicine is really focused on keeping you alive, super important.
Yes.
We want to keep you alive, but we also want you to be well. Slightly different focus of our imperative. And Parsley is making that kind of care, that approach to care, affordable and totally technology enabled. So that's how we're different.
How does it work as a patient? So you're here in New York City.
Yeah.
is it just like going into a regular doctor? Do you come in once a year? Do you come in all the time? How does it work from the patient's perspective?
Totally. So you're a member at Parsley Health. You're not a patient. You sign up for a membership. That membership includes 5 visits with me annually, unlimited health coaching sessions with my functional medicine trained coaches, and access to our community. We have regular workshops, events. We teach you how to shop for the right food at the grocery store. We teach you how to meditate. We have yoga classes happening around the city, and we have partners with yoga studios and other fitness studios. And that membership is really about helping you be well, stay well, or in some cases, people might have a chronic disease. So some people come to me because they want to like lose the last 5 pounds, or they're an optimizer and they've got their Fitbit and they want to get all of the kind of in-depth testing that we do. We look at your microbiome, we look at your hormones, toxicity levels, nutrient deficiencies, things that regular doctors like just don't look at.
And so you're not scared of technology, is what I'm hearing.
No. And then we do everything on a digital platform. So you sign up online and you schedule with us like you would at the Apple Genius Bar. We don't have a phone number, and we're the first medical practice in WeWork. So we have a very different vibe.
I think the WeWork model is very innocent. So your practice is in WeWork.
We're physically in WeWork, which we had to get special dispensation to do from the WeWork powers that be, but we are the first medical practice there. And, technology is all about like digital health is all about disseminating health and bringing it out into the community. And like, I don't ever want to be working in a hospital. People say, are you hospital affiliated? I'm like, no, I am like embedded in the place that like
that's where people are.
And so we're right there, and down the hall there's like a guy with a dog food company, and there's dogs walking by, and like my members, my patients, they walk in and at first they're like, where am I? And I'm so happy when they have that reaction, because we're really trying to flip the script from the use of technology to the pricing model to the setting. We're trying to like refresh medicine into the care we deliver,
and
which
even
is
the process.
The whole care delivery. We're not practicing standard of care. I don't want to practice standard of care. Standard of care sucks. That's 10 minutes once a year with somebody who hands you a stack of scripts. That's not the standard of care that I want.
So how do you
practice.
measure success with your members?
We measure success a couple of ways. We track a number of biometrics, so basic things like weight and BMI and heart rate and stuff like that you would expect. We also track some of that biomarker data I was talking about, nutrient deficiencies and so forth. We also track subjective data through online symptom questionnaires that track, people get a score, and oftentimes they'll come see us the first time and they'll come back and say, I'm feeling better. And we'll show them that their score went from 135 to 24. And that's like this really powerful thing. And then we're starting to use different apps, and we're partnering with different wearables companies to see how we can embed even more tracking into it. So whether it's a wearable and steps or light or breathing, some of the things that we've heard about today, I'm really interested in how we can integrate those things too. And then we're building our own data architecture internally to track outcomes, because I think that we should know what we're doing and if it works. And then we'll probably build on that. But
so, paint a picture for the vision. Is this will this be in WeWorks around the world at some point?
Absolutely. We're moving pretty fast on opening in California. LA will be first, maybe late 2015, early 2016. Maybe San Francisco after that. And then our goal is to both physically, and in WeWork would be great. I love those guys. They're awesome. But also virtually. We do a lot of virtual visits. Our health coaching programs are 100% virtual if you want them to be. Our medicine is mostly virtual. People usually come and see me in person the first time. And then after that, all of our follow-ups are on secure video or phone, whatever people prefer. And then as like telemedicine laws get a little less archaic, we'll be able to do the medicine 100% virtually as well. So it will be like everywhere and then everywhere.
I love it. So what are the biggest lessons learned, and put on your entrepreneur hat?
Oh, gosh.
What have you learned? This is your second business now.
Yeah.
Any advice, lessons learned that you can share with others?
Oh my gosh, I feel like I'm still so happy to be the recipient of all of this kind of advice.
Yeah.
Second startup, but definitely a lot of learning left to do. I think, For us, what's worked so far, we're entirely 100% bootstrapped, revenue generating, and are totally consumer facing, and that's going extraordinarily well. So we haven't
Don't be shy of the consumer model.
Yeah, don't be shy. If you have something that you think people actually want, and I saw that people wanted functional medicine. I mean, I was working in a practice where I couldn't afford myself, but very wealthy people were lining up the door, couldn't get an appointment for a month to pay $1,000 an hour or more to some of these functional medicine practices. People want this care. So if there's something that you think people actually want, don't be afraid to go direct to consumer. And I think there's this idea that consumers won't buy wellness. That's BS. Consumers are buying gym memberships. They're buying juice cleanses that cost $200 for like a day.
Right.
They're buying
the Fitbit
all
IPO
sorts of,
even shows there's a huge, massive consumer market for these things.
And the consumer wellness, I always use, my friend started a website called Mind Body Green, and there's a lot of wellness content on it. And they broke the top 100 most trafficked websites in the US. Like Yahoo was one day, and they were number 100. They have like millions and millions of monthly uniques, and they're just one in like this massive rash of the consumer wellness market is exploding. Like people are getting more conscious and they want this,
Yeah.
Yeah.
So are you testing other innovations in terms of technologies or solutions that maybe other startups are doing? Or what are you using in your practice? The reason I ask is maybe there's other innovators listening that, wow, they're hearing about Parsley and they're like, this sounds like the right type of place to really bring my innovation to.
Yeah, absolutely. So actually, we've done some work with Edamom, one of a startup health company that powers a lot of our nutrition data for our recipes, because we give a lot of recipes to our members, and they're awesome. And we're piloting a bunch of different health coaching apps right now. We tend to beta internally. We just finished betaing 2 different health coaching apps. I'm interested in wearables. I'm interested in companies out there that are helping people live healthier lives. And for companies where there's the right fit and the right program, we really want Parsley as we grow to be this like living innovation lab where, companies who maybe can't wrangle like a hospital pilot, there's resource issues with piloting anything anywhere, but for the right model, we'd love to just keep piloting different technologies, using them, sharing data, because we want Parsley to constantly innovate. And between like you guys and one of our advisors at Parsley is Indu Sabaya, who's the CEO of Health 2.0. So she obviously has a bird's eye view of
She's wonderful.
Health tech companies. Yeah. We're looking for like, who are our partners? Because I don't want to develop everything in-house. There's amazing stuff out there. I want to be able to use it.
So wonderful. I want to go to a speed round of questions, just some fun stuff.
Okay.
So do you have a favorite book that maybe you recommend to your members or even to other entrepreneurs or innovators?
The best book I've read in the past year, and I'm sure you get this answer all the time, is The Hard Thing About Hard Things by Ben Horowitz.
Yeah, that's a good book.
I come back to that a lot.
Yeah. Great book. So what would you be doing if you weren't doing Parsley?
Oh my gosh. I don't know. I would be like leading yoga retreats in Bali or something.
That sounds good.
But that's kind of the goal. We're going to do our first Parsley retreat, I think, in Mexico next year. And so we want...
Down in Tulum, probably.
Yeah. I don't know. Yeah, maybe. But I'm like, if I could just make my life like one long yoga retreat eventually, that's my definition of success.
That's a great goal. Who inspires you?
Oh my gosh. The people who inspire me are the people who, like Indu Sabaya again, and one of my first yoga teachers, Skylar Grant, who's one of the founders of Wanderlust, which is a huge global festival at this point. People who like follow their hearts and create a life for themselves they actually want while they create something with huge impact. So I see a lot of miserable founders and entrepreneurs who are unhealthy and unhappy, and the people who are successful to me are creating and innovating and having impact and making money, but they're also like have good partnerships with their marriage and kids and have like a life that looks nice. So those people.
So how do you stay healthy?
Oh my gosh. Well, I walk the walk. You work a lot. I do work a lot, but I like sit on one of those bouncy balls or like at a standing desk, and like I eat the Parsley Health, which is like a plant-based paleo style philosophy of diet. Like I live it, like not eating a lot of sugar and moving as much as possible, and like getting real on stress. The number one thing people coming in, like every single person, wealthy, not wealthy, successful, overweight, underweight, for every single person, stress is a huge issue, and most people only know how to deal with stress by drinking booze, eating sugar, or smoking a cigarette. So like meditating, getting outside, hanging out with people, like the things that keep me sane amongst the like crazy startup chaos.
I love it.
Yeah.
Okay, so last question.
Okay.
Words of wisdom or favorite quotes to share with
I'm
people.
terrible at favorite quotes. Wherever you go, then there you are.
I like that. That's a good one.
Sometimes that's when I have to just be like, here I am. All right, I'm going to deal with it.
Wonderful. So where can people learn more about Parsley,
Yeah.
and are you accepting members in New York?
We are. We're growing fast and accepting tons of new members. We have a medical membership. We have a health coaching membership if you want to work with just one of our health coaches on a personalized diet, exercise, and mindfulness program, and you don't necessarily want the medicine or the testing. You can do that. It's super affordable. It's $149 a month for 3 months. Our full medicine membership is crazy affordable. It's $149 a month for 12 months. And so it's like a gym or your iPhone bill. And we have 20 detox programs that you can just buy off the shelf and do yourself with shakes and all of these things. So it's super accessible. ParsleyHealth.co. We're not .com, we're .co.
.co. Okay.
That's it.
All right. Well, thank you so
Yep.
much, first of all, for doing what you do, and thank you for being here.
Thank you for doing what you do.
Thank you. We'll see you guys next week. Thank you.